The struggle of African migrants and refugees grabs the attention of U.S. policymakers. The World Health Organization ramps up the response to cholera outbreaks in Africa and the Middle East. And willingly trapped in a room, a new form of themed entertainment popping up across the U.S. Africa 54 starts right now.
Good evening, I'm Esther Githo Yuwat. Vincent Makori is off today. This is Africa 54. We begin our broadcast with a look at the African refugee and migrant crisis. The dire situation that has European leaders distressed has caught the attention of key policymakers in the United States.
Congresswoman Karen Bass is a ranking member of the Subcommittee on Africa. She recently hosted a forum to discuss the African migration and refugee crisis, hashtagged Where Are the Africans? And while the world's attention is focused on Syrian refugees, the Congresswoman wants to shine the spotlight also on the plight of Africans caught in the crisis.
Nearly a quarter of that total originates in refugee-producing nations in sub-Saharan Africa, including Eritrea, the Gambia, Nigeria, Somalia, and Sudan.
There have been several tragic reports this year of African refugees and migrants drowning at sea attempting to reach southern Europe. Some have ended up in Italy, Germany, and other European Union countries. EU's ambassador to the United States, David O'Sullivan, shared his perspective on the African migrants.
This is a multidimensional problem. You start with a migrant who turns up on your doorstep looking for asylum status, but then you work back through everything that has got that person there and the people who didn't make it there and what's happening elsewhere in the world. So it's going to require considerable ingenuity to address all the dimensions of this in an integrated way, because our systems don't always function in that way.
The Assistant Secretary of Population, Refugees and Migration, Ansi Richard, also says the full range of diplomacy to development and relief aid must be brought to bear in dealing with this tricky situation.
Harsh and worsening climate conditions, lack of opportunity, lack of education, lack of hope, and weak and fragile and sometimes downright bad governments is a toxic combination that is causing people to move.
Also in the forum was Dr. Sehaya Tefera, the president and CEO of Ethiopian Community Development. He says the international community need to pay attention to the African refugee and migration crisis before it is too late.
The Eritrean refugees, about 39,000 of them in Israel. There is no possibility for them to be integrated there. There are a large number of Ethiopians and other Africans in the Sudan, in Kenya. The anti-immigrant sentiment that had existed for many, many years now in South Africa. We need to do something.
Congresswoman Sheila Jackson-Lee summed up the theme of the hashtag, Where Are the Africans? She said the African Union should be involved in resolving this crisis.
There is no better unity than the organization that has all of the states there, both in terms of legislation, in terms of funding, where the lead entity are the countries themselves, where presidents sit and realize that you can't always have Nigerian refugees and people migrating always to Europe. You must, in your own space, be able to welcome them, albeit temporarily, because then it allows them to return, which many people want to do.
The panelists observed that most Africans are leaving their countries due to turmoil. Communities have been uprooted, and the desperation has led many to lose hope of making ends meet within their own borders.
Now to South Africa, where prosecutors say Oscar Pistorius should be convicted of murder and sent back to jail, while the defense argued that the sentence the athlete had received was appropriate and should stand. South African Supreme Court judges heard arguments on Tuesday from state lawyers that a High Court judge had made legal errors when she decided not to convict Pistorius of murder. The judges say they will issue their decision at a later date. The director of the University of Free State Law Clinic spoke about the case.
It is difficult to say what the judges will decide in this manner, so one can merely just speculate on the outcome, but the whole question of the dolus eventualis, the intention, to me stands out for the case for today.
Pistorius was freed on parole last month after serving 1/5 of the prison term given to him for the culpable homicide of his girlfriend, Reva Steenkamp, who he killed on Valentine's Day 2013. He has not been seen in public since then and is under house arrest that confines him to his uncle's home in a wealthy Pretoria suburb for the duration of his sentence. Now, the recent student protests that rocked South Africa were notable not because of the students' demands, but because of the medium and who it reached. Through social media, the movement, which represented a tiny fraction of South African society, got widespread attention in a way no movement has seen in a long time. VOA's Anita Powell has more from Johannesburg.
South Africa's recent student protests captured national and global attention. Not because of the message. After all, groups in South Africa have been demanding equality and opportunity for years, but because of the medium and who it reached. Most of the action happened here and here and here, in the middle-class enclaves of urban South Africa. Through social media, the movement sent out more than 350,000 tweets with the hashtag #PeaceMustFall. That has gotten the attention of a group that has largely remained silent in South African politics. The middle class. They're awake now, and that may pose a challenge to the ruling African National Congress ahead of next year's local elections. The party has long relied on the rural poor as its base, and the needs of the middle class are different. They want jobs, they want education, they want opportunities, and in a word, they want more. Anita Powell, VOA News, Johannesburg.
The financial services firm Alexander Forbes says more than 40% of Kenyans cannot afford to retire and must continue working. The firm says another 40% rely on family for support. The survey paints a sad picture of Kenya's ability to care for its growing aging population. Mohammed Yusuf reports from Nairobi.
Carrying a 20-litre jerrycan is not easy for this 65-year-old. Dominic Ologi retired 10 years ago after 3 decades in the public and private sector. But he, like millions of other aging Kenyans, must still work. He has no savings of his own for retirement. He gets $75 a month from his state pension.
During these times, I had a lot of time in my hands. And to supplement what my wife was bringing in, I looked at my environment, what my environment was lacking at that time.
South Africa-based investment firm Alexander Forbes says Kenya has the lowest mandated pension contribution on the continent, just 10% of income. The head of Kenya's Retirement Benefit Authority, Edward Odundo, says workers need to save more.
If you retire, you should be able to get at least 40% of what you used to earn. But if you are getting less than 10%, it shows that you have a big deficit, just even in the basics.
National Social Security covers most Kenyan workers, but the system is plagued by corruption and management issues. Alexander Forbes says nearly half of retired Kenyans depend on family members to survive. For some, that is not a problem.
Just nurturing in us as human beings to support, also give back to where we came from. Because look at it from this angle. They have taken care of you since you're young up to now, taking care of you up to school. And so literally it is also socially acceptable or socially moral, if I put it like that, to give back to mom and dad.
For others, it is a burden.
I get it's a bit hard because staying here in Nairobi is not cheap. When it comes also to rent and you are paying all that pension for me, I pay for 3 people, is not easy.
The World Health Organization says Kenyans are living longer than they did 20 years ago. That, combined with the ongoing population boom in Africa, means the state can expect more pressure to provide for the elderly in years to come. Mohammed Yusuf for VOA News, Nairobi.
Russian officials say everything is being done to determine the cause of Saturday's plane crash in Egypt that killed all 224 people on board, most of them Russian tourists returning to St. Petersburg from an Egyptian Red Sea resort. President Vladimir Putin is promising a thorough investigation into the Metro jet crash. Here's VOA's Zlatisa Hogg.
Initial reports say the Airbus jetliner disintegrated in the air before hitting the ground. Terrorist group Islamic State has claimed responsibility for downing the plane, but the aircraft's black boxes, the cockpit voice recorder and the flight data recorder will provide more reliable information.
The black boxes were found on the first day. They received insignificant damage, and after everyone involved in the investigation arrives, we'll start decoding the records. We'll do everything possible to establish the causes of the tragedy with the participation of international experts.
On Monday, President Putin made his first public appearance after the crash.
I would like to express my condolences to the loved ones and relatives of the victims. It is a great tragedy, and of course we are with you in heart and soul. I would like to thank the people of St. Petersburg for their reaction, which all the country has seen, and all the Russians for their words of condolence.
Putin stressed the importance of finding the cause of the crash so that authorities can take appropriate action. Officials of the Russian airline company ruled out technical or human error, saying only that external influence could have caused the crash.
There are no such faults like engine failure, system failure. There is no such combination of systems failure that could lead to a plane breaking up in the air. Yes, under a tragic multi-level contingency when several systems fail, along with some other accompanying factors, that indeed could lead to a catastrophe. But in that case, the aircraft would break up through hitting the ground. Aircraft cannot break up in the air because of a failure of any systems.
Russia has sent about 100 experts to help Egyptian authorities search for the remains of victims and the aircraft debris. The United States has offered help with the investigation. Zlatisa Hogg, VOA News, Washington.
We want to know what you think about Africa 54 and the stories we cover. Join the conversation on Facebook. The address is Africa54, and check out our headlines 24/7 on voaafrica.com. Coming up, stepping up efforts to control multiple cholera outbreaks. Stay with us.
This is Greenbeat for a healthier planet.
Even domestic animals can become endangered, like the Vaughan cat, for example. This rare breed has been brought back from near extinction by the Vaughan Cats Research Center in Turkey. This white cat was a popular pet throughout the city of Vaughan for centuries, but by 1992, researchers could only locate about a dozen. Dr. Abdullah Kaya is head of the Vaughan Cats Research Center.
Since then, we have been breeding them. Right now, there are nearly 210 cats in here.
What makes this cat so unique is its oddly colored eyes, one amber and one blue. Researchers say the odds of other animals having different colored eyes is 1 in 10,000. For the Vaughan cat, it's 16 out of 100. Here's researcher Nahid Aktash.
This is a genetic problem, but this problem makes them unique in the world.
The Vaughan Cat Research Center now attracts about 20,000 cat-loving tourists a year. I'm Rebecca Ward for VOA's Greenbeat.
And it's time now for a health report, and joining us now is Africa 54 health correspondent Lenore Modu with the latest news on cholera. Hello, Lenore.
Hello, Esther. The World Health Organization is responding to multiple cholera outbreaks that could flare up and threaten the health of more people if control measures are not intensified. More than 10,700 cholera cases and almost 200 deaths have been reported in 5 countries in the Eastern Mediterranean and African regions: Iraq, Bahrain, Kuwait, Democratic Republic of Congo, and Tanzania.
Most cases of cholera actually are not symptomatic. People get infected and don't show symptoms. So they could travel with the Vibrio because they are just infected. The difference is that if you get cholera, let's say like here in Switzerland, it's not going to spread further because the water that we use for drinking is clearly separated from the sewage system.
Spread of cholera is a major concern if control measures are not taken urgently. The cholera situation in the African region is especially worrisome.
Our concern for Tanzania and Eastern Africa in general is the forecast, the weather forecast of a very bad El Nino season. And the last time we had this, it was in 97, 98 in that region, and we had 200,000 cases, 8,000 deaths just in 4 countries of the region.
Iraq's health ministry says the country is carrying out a major vaccination campaign to combat the outbreak that has infected more than 2,200 people. The campaign focuses on vaccinating people displaced by conflict. In all affected countries, WHO and health partners are supporting the ministries of health to treat and prevent the further spread of the disease. Patients are being treated with oral rehydration salts, infusions, and antibiotics.
You will have 40–50% risk of death if you don't rehydrate patients. That's the key to the treatment. And with good treatment, we observe less than 1% of patients dying. Still high number because we have a lot of cases, but it's much better than if you don't treat them. Then the second very important action to put in place as soon as possible is to provide people with safe water.
Increased surveillance at the community level for case finding, provision of safe drinking water, improving sanitation are some interventions to control the outbreak. In addition, widespread communication campaigns are ongoing to encourage families to purify water, prepare food carefully, and wash their hands. Cholera is an acute intestinal infection caused by ingestion of food or water contaminated with the bacterium Vibrio cholerae. It has a short incubation period and quickly leads to severe dehydration and death if treatment is not promptly given.
Joining us now live via Skype from Olympia, Washington, is David Albert, board chairman of Friendly Water for the World. It's an organization working to expand global access to low-cost clean water technologies and information about health and sanitation. Mr. Albert, welcome to the show.
Well, thank you.
Your organization has been actually working on the ground. Can you give us an assessment of the situation in Africa?
Well, we have seen cholera outbreaks in at least 4 countries. The biggest outbreak by far is in the northeastern part of the Congo, where since January there have been perhaps 100,000 cases and 2,000 deaths. We have been working specifically in the 26 orphanages in Goma, where we found since January there had been more than 700 cases and 67 deaths. But we were able to wipe out every single case of cholera in the 26 orphanages.
But presently, the outbreak is still expanding. Is this correct, or has it been contained?
We receive new reports almost daily. There's been an outbreak in the Masai Mara region of Tanzania. We have seen some cases in western Kenya as well, and we've gotten reports of cases in Ghana.
So what is happening, really? What is the problem there? Why is it still spreading if the WHO and other organizations such as yours are involved in trying to contain it?
The difficulty is simply the lack of clean water. Especially before the rainy season, cholera concentrates in the shallow water that people are using for drinking, cannot purify their water. These are areas that don't have access to clean water systems. What we do is teach people to build themselves, to build biosand water filters, a very simple technology that can remove virtually all Vibrio cholera from the water supply.
So is there some type of anticipation as to when this could be contained?
Actually, I don't know. Again, we don't work specifically with governments, but with local people on the ground who are working to wipe out all cases of cholera themselves.
And how can government contribute to this and make your work easier?
Well, first of all, government needs to make clear to their citizens what's actually causing the outbreak. Good sanitation and hygiene could make a very big difference. Building of latrines in public places could help greatly. And making sure that the sources of water aren't contaminated. Cleaning water is fine, but if you can get to the source of infection, people are better off.
And quickly, the way forwards in terms of working in the DRC for your organization, quickly.
Yes, well, we have a medical officer based in Goma. We're working all over the Northeast, North and South Kivu provinces. We are training people to build their own biosand water filters. People, if they have the knowledge and the skills, really can deal with this themselves.
Okay, thank you so much, Mr. Albert. And that was David Albert. He is board chairman of Friendly Water for the World. And that's our Africa Health Report for today. Back to you, Esther.
Thank you, Lino. Be sure to watch Lino Mudu's health reports every Tuesday and Thursday right here on Africa 54. Continuing our profile series on Young African Leadership Initiative, today's focus is on a young man who heads the anti-poaching department at the Selous Game Reserve in Tanzania. He spent part of his internship at Yosemite National Park in California to learn more about wildlife management techniques and natural resource conservation ideas.
My name is Lazaro Michael Tipap from Tanzania, and this is Al Capitan, the highest rock in North America. This yearly program helped me broaden my knowledge, first of all. See you later. Right. It also gave me a lot of experience and kind of very nice skills on leadership. Today we'll be kind of doing patrol, mostly looking on location of bears using the tracking devices that we have like telemetry. The early fellowship has been so much important because first of all it just kind of opened me and give me a lot of networking. Not only from the American people, but with also fellow African people. Why we are doing this? We are doing this because it is very important, because if bears go on eating food, human food, they will become problems. So we avoid these things because actually if we start habituating bears, they will change in their normal habit and become totally problem animals.
It's been really good to work with him. He has a lot of different experiences coming where he comes from. He gives us a lot of different input on working with different animals and different types of management strategies. So it's a fresh view for us from what we do every day to what he does where he comes from. So it's nice to get a different perspective.
We've learned a lot from him because we haven't had a program like this where we've had an intern from Tanzania or any African country at all working with our wildlife program. So it's been a really interesting experience having him come from a completely different situation with really intense issues, really, life or death problems in their park, in their refuge in Selous, where you have commercial poaching going on.
What I do back home there is mostly we do kind of anti-poaching activities like supervised patrol groups with rangers inside and outside the protected areas. We do kind of ecological monitoring. And so we also give conservation education to the local people that surround the park. If I check now, this park like Yosemite is 125 years old. But 150 years ago, the same thing was happening that what is happening in Africa. Okay? So, but the government used a lot of power, used a lot of resources to educate people and try to help people and develop people. At the end of the day now, these parks are free and they are safe, and you can see everybody who is coming here is enjoying. So those things are possible if only government will now start thinking about the local people that surround the parks. This yearly program helped me is it broadened my knowledge, first of all. It also gave me a lot of experience and kind of very nice skills on leadership. But the day that I was called by the embassy that I'm one of the people that was selected, I was very much excited. I didn't believe that. So yeah, at the end of the day I say, okay, I did it also, so I'm doing great thing if at least people have seen what I'm doing. So I was very much excited.
It's time now for a short break. Still to come on Africa 54, a new form of entertainment trends in the US. We'll be right back.
If you've just joined us, I'm Mariama Diallo, and here is a quick recap of today's headlines. Central African Republic violence escalates between Christians and Muslims, forcing people to flee their homes and threatening cancellation of Pope Francis's visit later this month. The South African Supreme Court will deliver their judgment at a later date on prosecution's call for conviction of murder in the Oscar Pistorius case. In South Sudan, 13 United Nations workers freed after being kidnapped by rebels a week after their abduction. In Nigeria, President Muhammadu Buhari pushes for a revival of the agricultural sector in order to boost the economy.
That's all for today. Thanks for watching. We'll see you next time.
And welcome back to Africa 54. Here's what's trending. Facebook CEO Mark Zuckerberg says that connecting India is key to Facebook's ambition of connecting the world. Speaking at a town hall in New Delhi, he reiterated his support for net neutrality, which is the principle that all websites on the internet are treated equally. India accounts for 1/10 of Facebook's 1.5 billion monthly active users. While in India, Zuckerberg also visited the Taj Mahal. Next up, a retail backs a major trend. The Seattle-based recreation and sporting goods giant announced it will close its stores on Black Friday, but it will still pay its employees to go outdoors. Black Friday, the day after Thanksgiving, marks the start of the holiday shopping season. It ranks as the busiest U.S. shopping day in terms of sales and traffic. Traditionally, retailers would go into the black earning a profit. Once they entered that season, REI is asking consumers to share photos of their outdoor say Black Friday on its website. And finally, a group of 18 co-workers trapped in their small room with just 45 minutes to solve a series of puzzles and win their freedom. Sounds a bit torturous, yet it's an entertainment craze popping up across America. It is a bit like being inside a video game, which is in fact how escape rooms began. In 1988, a game called Behind Closed Doors trapped a person in a room. A real-life version of the game opened in Kyoto in 2007, and the trend soon spread throughout Asia, Europe, and now the US. The escape room is a challenge. Only 20% of players actually solve the mysteries in time without hints. And that's what's trending today. That's our show for today. Be sure to watch Africa 54 on our website at voaafrica.com. For more news, tune into VOA's evening radio show, Africa News Tonight at 1800 UTC, and in the mornings to Daybreak Africa between 0300 and 0600 UTC, Monday through Friday. Thanks for watching, and good night from Washington.